First thing we start with our BSI. She'll talk about when an oral airway cannot be used and can be used, and we're assuming this patient is in a state where they have no gag reflex and need an airway. First thing she's going to do is select the airway, which is oropharyngeal airway, and measure from the corner of the mouth to the tip of the earlobe. After she does that, we're going to do it two ways. The first way she's going to do it is she's going to put it in upside down and rotate it from the roof of the mouth.
Use cross fingers?
Yep, cross finger technique. Roof of the mouth, and make sure it's in the correct size. And then after it's in, she's gonna verify the airway's patent with a bag valve mask. So she'll make a C and an E with her hands and ventilate to make sure that the airway is functioning, that she's getting chest rise at it. Okay, the second way that we're gonna do this, so we'll pull this out. As she's taking her BSI, she'll open the airway with cross finger technique, take a tongue depressor or a tongue blade, displace the tongue, she's already measured the airway, so we know it's the correct size, and she can show that again. And then she's just going to go in with anatomy. Once it's in, she'll take the tongue blade out, and she'll ventilate. You can see in the knee and ventilate. Perfect. Just stop. Okay, this is the nasal airway. She takes her BSI. She verifies the need for putting this airway in. She's going to measure it from the tip of the nose to the earlobe. Making sure, checking the diameter as well. The first thing she's going to do is go in the right ear and just go bevel in and go with the anatomy after she puts some lubricant on it. So she has it measured. She's going to go and bevel in and down, and she's going to verify it now with a bag valve mask.
My hand's all greasy.
Okay, we'll take that out, and the second way we'll do it, we'll go into the left nostril. And once again, she'll measure it. Make sure it's the right size. She's already lubricated it. And now she'll go upside down actually, so the bevel is towards the septum. And then spin it as she's going in to go with the anatomy. And once it's in, she'll ventilate with the bag valve mask. Good job. Stop. She's going to measure and insert an oral airway to ensure that there's no gag reflex. Once that's in place, she's going to have Zach ventilate the patient about once every 5 seconds. So she's going to use ventilation and count out to 5. While he's doing that, she's going to remove her Combi Tube from the wrapper and check the balloons on it and check the integrity there. She's going to put 100 into the blue. Then she's going to put 15 into the white, which is the number 2. Then she's going to deflate them and checks her balloons and then deflates them. She's going to lubricate the end of her tube. Miss Ackrick, you're putting something on there. There you go, so the tube is lubricated. Now she's going to tell Zach to step aside. Pull out the oral airway, then do the tongue jaw lift. And put it in with the curvature of the mouth. And she's going to put this in until the teeth are between the black lines. There you go. Probably should have lubricated that a little bit more.
Probably should have checked this mannequin.
Yeah, let's take it out and do it over again. Ready to go? This is CombiTube take 2. She got her BSI on. She She's going to insert a simple airway adjunct after she measures her oral airway, and then cross finger technique. Puts it in. Now she's going to have Zach ventilate or pre-oxygenate the patient, so he's going to ventilate about once every 5 seconds. While he's doing that, she's going to prepare her Combi Tube. So open up your Combi Tube. Okay. She's going to take her Combi Tube out, and she's going to put 100 milliliters of air into the blue, which is the number 1. And what she's doing is just checking the cups. And she's put about 15 into the smaller. Now she'll deflate them and refill the syringes. Now she's ready to place the Combi Tube. She's going to lubricate it with some type of lubricant. And she's going to tell Zach to step aside. Pull that up. Zach, you can pull the mask off of the bag valve mask so you're ready. Steam into the tongue jaw lift. Put it with, go in with the anatomy. So the teeth are between the 2 black lines. Once that's there, she's going to take her syringes and put 100 into the number 1. Pull it off, then put 15 into the number 2. As she fills that, she'll check her pilot balloon there. There we go. Okay, now she'll drag Zach to ventilate to the number 1, which is the blue. While she gets the stethoscope out, listens to the stomach. Now she would expect to hear nothing in the stomach, and then she would move on to the lungs. And then right, left. Now if we keep going and she listens to the stomach, and she hears sound in the stomach, she would direct Zach to ventilate to the number, and don't ventilate a lot, Zach, when you do this. So she would listen again, and then check the lungs, right, and then left. If there was lung sounds and stomach sounds heard, they would pull it out. If at this point, if they only heard lung sounds on the right side, they would deflate the cups and pull back a little bit. Now to take the Combi Tube out, remove the bag valve mask. She's going to put the big syringe on the blue pilot balloon. And this is something that's done after you...
Do you want to show securing it? You can do that.
Oh yeah, let's back up a little bit. Securing it is done with commercial device here. Tape can also be used. Good. To take the Combi Tube out now, she'll take the device. She undoes that, undoes the clamp, pulls the device off and sets it to the side, and now would have the blue balloon deflated. Take 100 milliliters of air out of that. And then take 15 out of the smaller balloon. And then pull it out and turn in the patient onto their side. And also having suction ready. Good.